Hi, good morning. This is Dr. Summer from Trinidad and Tobago, navigating the healthcare system of Trinidad and Tobago. Continuing our series, today we will be talking about the public healthcare system in Trinidad. So in Trinidad, we do have the public healthcare system, which, as I mentioned before, is free for all citizens and permanent residents. I want to make a little correction. Working citizens do pay a health surcharge every month, but this is the equivalent of $6 and just a very small portion of what is contributed to healthcare. The majority of healthcare is taken care of by the government of Trinidad and Tobago. Right, so if we're speaking about the public healthcare system, basically there are three categories of institutions. We have our large hospitals, we have our district health facilities, and we have our health centers. So let's talk about the large hospitals. The large hospitals we have located in Northwest, which would be Port of Spain General. We have North Central, which would be Eric Williams Medical Sciences Complex. And in the east, we have the Sandy Grande Hospital and Arima Hospital. We have Couva Children's Hospital, which is central. And then we have in south, San Fernando General Hospital and the Point Fortin Hospital. So these hospitals are large, meaning that they have emergency departments, they have wards, they have clinics, health clinics for a variety of medical problems. The emergency department, all emergency departments, the healthcare services offered are free to everyone. Citizens, permanent residents, and non-citizens. So if you go into any hospital as a vacationer, as a tourist, as a visitor, the emergency services are free. You don't have to pay anything at all. However, if you have a more serious problem, for instance, you require emergency surgery, you would get emergency surgery services for free. You do get antenatal care services for free if you are a non-citizen. But if you have to join a clinic, for instance, if you have high blood pressure or you are found to have cancer and have to join the oncology clinic, those services are not free for non-citizens and non-permanent residents. Right? And then you must remember, because it is covered by the government, these services are basically, people are managed based on the urgency of their problems. So if you go into the hospital and you're getting some abdominal pain, a little bit of vomiting, and somebody comes in who was in a serious motor vehicular accident, or they're having a heart attack, or they were shot, you will have to wait. You will have to wait. The more emergent, the serious cases will be catered for. And that is one of the reasons why when people go into the emergency department in hospitals, they tend to have to wait sometimes 2 to 6 hours before they are seen, because there are a lot of times much more serious cases coming in. So that's something to keep in mind if you go in for a minor problem. If you get a minor, what we would call a minor laceration, a minor cut, or if you have a fall and you just have some tissue swelling but nothing is broken, etc., you will have to wait. So that is one of the shortcomings of the public healthcare system. But again, it's a free service. So that is something to consider. People coming in with more serious cases or more serious problems will be catered to first. So if you have any questions or you have any comments or you have any concerns, feel free to put us in the comment area and I will try my best to respond. Right, so that's the end of our public healthcare discussion on hospitals.